Hello friends, welcome back to week 7 of our course on climate change and disaster risk management. In the previous unit, we discussed public health challenges during disasters, how poor hygiene, disease outbreaks, and disrupted healthcare can endanger physical well-being. But there is another kind of impact that's less visible, one that affects the mind and emotions. Today in Unit 7.2, we'll focus on mental health and trauma. Understanding psychological well-being during and after disasters and how stress affects different categories of people and what can be done to support vulnerable groups. Wounds on the body may heal in weeks, but emotional scars can last for years unless we acknowledge and address them. So, mental trauma during disasters should be dealt with more diligence. Now, what is psychological health in disasters? When we talk about disasters, it reminds us of collapsed buildings, floods, and fires. But it also has a deeper impact on people's mental and emotional stability. Psychological health refers to how well a person's mind can handle stress, anxiety, fear, or grief, especially in difficult situations. Disasters bring sudden loss of homes, livelihood, loved ones, and the loss of sense of safety. It's natural to experience emotional reactions during disasters, such as shock and disbelief, fear and confusion, anger or helplessness, a sense of guilt, and sometimes complete numbness. But when these feelings last for weeks or months, interfering with daily life, they may turn into deeper psychological conditions such as post-traumatic stress disorder, PTSD, depression, or anxiety disorders. As it was seen after the 2013 Kedarnath floods, many survivors reported long-term anxiety and difficulty sleeping even after being safely resettled. So, managing mental health should be an essential part of disaster recovery. Now let's understand mental trauma. Mental trauma means the deep emotional wound caused by witnessing or experiencing a distressing event like losing family members, seeing destruction, or surviving extreme danger. It can be primary or secondary. Primary trauma is directly experienced by people caught in the disaster. Secondary trauma is experienced by responders, healthcare workers, or volunteers who witness suffering repeatedly. As witnessed after the 2004 Indian Ocean tsunami, not only survivors but also many rescuers showed signs of trauma such as flashbacks, emotional withdrawal, and disturbed sleep. This shows that disaster response must include psychological care not only for victims but also for responders. Now let's understand different phases of mental health reactions after disasters. While everyone reacts differently, there are some typical stages most people go through after a disaster. There is an impact phase, confusion, panic, or numbness during the event. Heroic phase, people help others selflessly, fueled by adrenaline. Honeymoon phase, after survival, community unity, and relief. Disillusionment phase, when recovery feels slow, frustration, anger, or exhaustion set in. Reconstruction phase, gradual emotional healing and rebuilding of normal life. Understanding these phases help responders and families support affected individuals more effectively. Now coming to stress and its management. Stress is one of the most common mental health challenges in any disaster. It is a natural response. But if it continues for too long, it can harm both physical and mental health. Chronic stress can lead to headaches, poor sleep, high blood pressure, and even reduced immunity. So, how to help people manage stress in crisis situations? By expressing feelings with friends, families, or counselors, help reduce anxiety. By staying connected through group activities. By having a regular schedule for meals and sleep gives stability. Physical activity through simple exercises and yoga can reduce tension. Spiritual or cultural practices like prayer, music, or meditation can comfort many people. If distress persists, then professional counselors or psychologists' help can be sought. In 2020, Assam floods, community shelters introduced evening circles, small group discussions where people shared stories, songs, and prayers. These simple gatherings became powerful tools for emotional relief. The message is clear. Emotional support can come from both professional care and everyday practices. Vulnerable groups like children, women, elderly people, people with disabilities, and frontline responders need special mental and emotional support by offering targeted psychosocial support. Mental health recovery is a community effort. In India, the National Disaster Management Authority (NDMA) and the National Institute of Mental Health and Neurosciences (NIMH-ANS) have worked together to create psychosocial support and mental health services. These services focus on training community volunteers and health workers to offer basic counseling, setting up mental health camps in relief areas, integrating psychological support into school and workplace recovery programs, providing telecounseling for remote or affected areas. As it was seen in Kerala floods in 2018, the state launched Chiri, meaning Smile Initiative, offering free counseling, helplines, and peer support for children and families. Similarly, during the COVID-19 pandemic, helplines like Current connected people to mental health professionals nationwide. So, mental health care is most effective when it combines community participation, trained professionals, and consistent communication. Healing after trauma takes time, but it's possible. Resilience means bouncing back despite pain, but learning to find hope again. Communities that talk openly about their struggles, support one another, and include emotional recovery in disaster planning often recover stronger than before. In the Bhuj earthquake 2001, after months of psychological outrage, survivors not only rebuilt homes but also created new community spaces, cultural events, and memorials, turning grief into collective strength. So, emotional recovery is not just personal, it's social, cultural, and deeply human. So, friends, managing mental health and trauma is an integral part of disaster management. Emotional recovery brings stability, courage, and community spirit, the invisible threads that hold societies together after crisis. But for such support to work, we need strong, well-trained systems. So, in our next unit, 7.3, we'll discuss building healthcare capacity. Until then, remember, healing begins not with medicine, but with empathy, listening, and hope. Thank you, and see you in the next session.